Today on the show, we have Dr. Nell Wieman. She's the Acting Deputy Chief Medical Officer at the First Nations Health Authority. And we're here talking about COVID vaccines again, because there's still a lot of people out there that are very hesitant to go and get immunized. And there's a lot of misinformation going around. So we wanted to talk to some of the top docs in the country and just ask them their reasons about getting vaccinated, and kind of just ask them some questions about common questions that people have. And I know you're a great resource, so I'm so happy to have you here.
Thanks for having me, Shar.
All right, so let's get started. So, Dr. Nell, what are the different side effects for youths that are getting it? Because now I know that they're able to, if you're between the ages of 13 and 17, it's approved for them, but do they have side effects specifically for youth?
Well, the vaccinations are now available vaccines are available now to young people 12 and older. And we're waiting for approval for younger than that. The studies are still being done. But in general, the side effects are really no different between young people getting the vaccine and older adults. So the most common side effect that people have generally is soreness or redness or swelling or itching at the site of the injection when they get it. May last for 1 or 2 days. And other side effects would be things like headache, feeling tired, perhaps a bit of dizziness, nausea. But again, those are very temporary. They only tend to last a couple of days. And if people need to take a Tylenol or an ibuprofen to help their symptoms, they're welcome to do that. The thing to remember about side effects is they're a sign that the vaccines are working. It's your immune response that's taken in has had the vaccine and is mounting an immune response, so that if you come in contact with the COVID virus, then your immune system is already building itself up. So very rare do we have severe side effects.
What about allergic reactions? Do they ever trigger allergic reaction?
Yeah, I mean, I think there's a bit of misunderstanding or confusion about what a side effect is versus an allergy. So for example, what I was mentioning, the pain or redness, that soreness or redness at the site of the injection site. And some people can have like a delayed reaction to the vaccine, where their arm a week after the injection might get swollen and a bit red. And as I said, that's more of a side effect that we treat with, if it's really that painful, you can take a Tylenol or an ibuprofen, or if there's any reason why you can't take one or the other, just check with your doctor, and like a cold compress or ice pack on top, and it will go away. There are very few people who actually have allergies to the ingredients that's in the vaccine. So for example, egg is not used. That's a common one that people, an allergy that people have in other vaccines. The only one that people might have heard about in the news is polyethylene glycol, or PEG, P-E-G. And some people mistake that for ethylene glycol, which is antifreeze. Antifreeze is not in the vaccines, but polyethylene glycol sounds the same. It's an ingredient that's used in cosmetics, face lotion, some processed foods and drinks. So it's often used, and it's used in the mRNA vaccines, so Pfizer, Moderna. But having an actual allergy to PEG is extremely rare. You would probably know it if you had it. So if you do have, if it is known that you have a PEG allergy, you should definitely not have the mRNA vaccine. But in any case, talk to your healthcare provider before vaccination. But for the majority of us, severe allergic reactions are very rare. I think tens of millions now of doses, I think almost 48 or 48 million doses of vaccine have been given in Canada. And we have only had 100 something actual severe anaphylactic reactions. That's the one where people have a hard time breathing and they need the EpiPen, etc. That's why they make you wait 15 minutes after you've had your dose, and then you can be on your way.
And I know there are different kinds of vaccines. You just mentioned Moderna and Pfizer, but there's AstraZeneca. And I know that a lot of people have been hesitant around the AstraZeneca. I'm not exactly sure why, but I know that they are. Is that vaccine safe?
Yeah, so it's important for your listeners to know that all of the, the 3 vaccines that have been approved by Canada, by Health Canada, have met the quality, have met the standards for quality, safety, and effectiveness. So we wouldn't use them if they didn't work, and we wouldn't recommend them or get them ourselves if they weren't safe. And the quality of the vaccine, of course, it's standardized for the different vaccines. So there's confusion around the different types of vaccines. So as I mentioned, Pfizer and Moderna use the mRNA technology, whereas AstraZeneca is what's called a viral vector vaccine, meaning it uses a different mechanism to teach our immune systems how to respond and fight back against the COVID virus. So all 3 of them are safe. I think, unfortunately, there was a lot of changes in the messaging when it first came out. And of course, there have been some really rare side effects or consequences of the AstraZeneca vaccine that are important to know about. So the risk of blood clot, a specific blood clotting disorder. But again, I will emphasize this is a very, very rare event. And if you have any concerns, if you're still hesitant about or still thinking about having the vaccine because you're worried about something like blood clots, then you may want to talk to your healthcare provider. But in general, I think now in British Columbia, we're sticking mainly to the mRNA vaccines.
And how long are the vaccines effective for? Do you think we're going to need booster shots?
That's a really good question, Shar, because I think the honest answer is we don't really know. These vaccines were developed, within the last year and a half or a bit more. The first vaccines rolled out here in British Columbia in December of last year. So we don't really know. We do know, as following people as long as we have, that people still maintain a good, strong immune response, several months after having the vaccine. So right now, I think we're not focused so much on booster shots, but it's important for me to clarify that when I say booster shot, that is people wondering if we're going to need a 3rd shot or a 3rd jab down the road. The full dose of immune response that we're getting right now from our vaccination rollout is the 1st dose and the 2nd dose. Both of those doses need to be had for you to be considered fully vaccinated.
And phase 3 just kicked off at the beginning of July, and a lot of us are really excited about the possibility of being able to travel again. Do you think we're going to need to have both vaccinations, be fully vaccinated before we can even leave the province, country, all of that stuff?
Yeah, I think, again, there's a lot of different, people have a lot of different answers because I think, we need to be clear about the messaging. I think the rules are different depending on where you're going. So, for example, we can cross the provincial border into Alberta, and I don't know if, I don't, we don't need necessarily, we're recommending people be fully vaccinated, but some people might not, right? It's always just as a general, I think, rule of thumb moving forward from here on. If you're thinking of traveling anywhere to a different region, to a different province, to a different country, that you be fully vaccinated. That's probably the safest way for it to go. Being fully vaccinated doesn't necessarily mean that you won't get COVID, right? It doesn't provide 100% protection. And every jurisdiction is different, right? So going to countries, some countries may want you to be fully vaccinated with vaccines that they approve of. And so the best, rule of thumb is be fully vaccinated and check the rules of whichever place you're thinking of going to make sure that you meet their requirements as well as Canada's.
I know we're right smack in the middle of summer, but flu season is really just right around the corner, and people are going to start getting their immunizations for the flu. If you haven't gotten your COVID shot yet, but you're planning to, and you get your flu shot, should you wait? Should you space it out between you get the two?
I think the general rule of thumb is to wait 2 weeks in between different vaccines. So obviously our preference, I think at this point, would be to get your COVID vaccine, wait a couple of weeks before you get your flu vaccine. I know one thing I've heard a lot of people saying over the last little while is, you know, by adhering to the public health measures and wearing that mask, especially in indoor public spaces, people haven't had colds. Like I haven't had a cold in 18 months or 17 months. Like it's incredible. I'm so happy. So I think, you know, it depends on the person, but I think I'll keep it up for a while yet.
And we were kind of talking about the different vaccines. You kind of mentioned the differences, but what was the big push? Like, why are there so many different vaccines?
Yeah, I mean, I think the first thing that, you know, people need to recognize is, you know, this was a global pandemic. You know, it affected all of us all over the world. And so that spurred on researchers in different places to think, how can we, you know, develop a vaccine as quickly as possible? So that resulted in a couple of different approaches. But mainly, as I mentioned before, really the difference in approaches is really how the vaccine gets into us and helps our bodies learn how to mount an immune response to the COVID virus, so that there's differences in the mechanisms, but the ultimate goal of all of the vaccines is the same, right? It teaches our immune response to recognize the COVID virus, mount an immune response against it. So even though we may be vaccinated, fully vaccinated with 2 doses, that, as I said, you could still potentially get COVID, but the goal is to reduce serious illness, hospitalization, intensive care, the need for intensive care unit, and potentially death. And the vaccines work very well at preventing those 4 things.
Even as the virus mutates, I know there's a lot of talk about cases rising amongst unvaccinated people, and the Delta variant seems to be mutated and a lot stronger than the original COVID-19 virus. So do you think that the vaccine is still going to be effective as it mutates?
Yeah, I mean, I think the bottom line answer to that is we don't know exactly. I think it's really important for people to know that, you know, these variants of concern, the Delta variant is, as you said, is more easily transmissible and can result in more serious illness with some of those consequences I talked about: need for hospitalization, intensive care, potentially death. This is turning into a bit of a pandemic of the unvaccinated right now, where a lot of the virus is spreading among people who have been unvaccinated and who have not been following the public health guidance. You know, 2 things, the way that I explain it the clearest, because I think what we're here to talk about is people who are wondering, people who have questions, and those questions need to be answered to help people make that decision. And so viruses really have 2 major functions or goals. They want to transmit from one person to the next, and they want to mutate. That's all the virus wants to do. So if we get vaccinated, if we in indoor public spaces, especially now, continue to wear a mask, continue to stay physically distant, then that virus has nowhere to go. And the more people that are unvaccinated, that allows the virus to transmit and mutate, and resulting in variants like the Delta variant. So that's why I say we don't know, because the longer this pandemic goes on, the more this virus will mutate. So we know that there are potentially variants still to be created by the virus. So that's why people are really asking us to all join in together, be fully vaccinated, and stop this virus in its tracks and stop it from mutating.
And as far as community immunity goes, how long do you think we are away from that?
Yeah, again, I think there have been different numbers that have been put about around, what is the percentage people vaccinated do we need to reach community immunity or herd immunity? One of the numbers is 90%. Some other numbers that have been shown have been a bit lower than that. I mean, I think ultimately community immunity is going to be really difficult to achieve because we are all mobile, right? We travel not just from our home communities, but we go visit relatives in other communities, we go visit friends, we go on weekends away or vacations. And so until most people or significant majority of people are fully vaccinated, we won't have that community immunity, but we can't say for sure when that will happen. I think the other thing to keep in mind is, I mentioned at a while ago that this is a global pandemic. So we need to really work together between countries and cooperate to get the entire world fully vaccinated at some point.
There is a big group of the world, though, that still isn't eligible to get their vaccines. That's the under 12. When do you think they're going to be allowed to go and become inoculated?
Yeah, as I mentioned, so 12 and over are eligible for the Pfizer vaccine. And the studies are underway looking at smaller children, so younger children, 11 and younger. So those studies are underway. We don't know exactly when that's going to be. We anticipate that it will be approved for younger kids, I think over the age of 5, but I don't know exactly when that's going to be. But it is important, right? Because especially for First Nations people, we are a younger population with, we have lots of young people under the age of like 17, 18. So it'll be really important when that approval comes for people to think carefully, given that the vaccine is safe, effective, and of high quality, that, we'll all, I think, feel a little bit more relieved when as many people as possible are fully vaccinated.
What about people with pre-existing health conditions or, a concerning medical history? Do you think that they should be discussing things with their doctor before they go and line up to get the vaccines?
Yeah, I mean, absolutely. If people have certain severe medical conditions such as cancer or a history of a medical condition that affects their immunity or their immune response, then I would, all of the physicians in the OCMO at First Nations Health Authority would recommend talking to your healthcare provider first.
And as far as people, I know you kind of mentioned it before, but as far as people having both vaccinations and going out in public, can they finally get rid of the mask?
Yeah, I mean, I think, as far as the public health orders, the mandatory, the must wear a mask in public spaces has been lifted. It's important for people to know that the vaccines, for example, they do provide excellent protection, especially against some of those severe consequences that we talked about earlier. So you could still potentially get COVID, but it may not result in serious illness as if you weren't vaccinated. Many public places are still asking people to wear their masks. So there is a bit of personal choice in this. For myself, being fully vaccinated just over a month, I am continuing to wear my mask in indoor public spaces. And that's a personal choice that I make. There's still some places that require masks, and the way that I be a good citizen is as I wear my mask and I don't give them a hard time about that. I think it's important to remember that everybody is reopening at their own pace, right? So some businesses, some public places still would prefer people to wear masks. And so I think, trying to be a good citizen, and looking after my own safety and the safety of others, I choose to wear my mask in indoor public spaces. But outdoors, I haven't been wearing my mask. And for the first time, actually last night, my partner and I got together with a friend, and we had a picnic outside and enjoyed each other's company. We weren't on top of each other, but we were far enough away, but we still enjoyed ourselves having a picnic outdoors. And that was the first one in like, over a year.
That's awesome. That's a very good reason why to get vaccinated, spending time with friends. But I want to know your personal reason why you chose to get both of your vaccinations.
Well, my personal choice to get, first of all, I have to say, I just want to leave your listeners with a really important point. We want to approach people who maybe, thinking about or having a hard time coming around to the idea of getting vaccinated. We want to meet that with compassion, with information, with kindness. And hopefully, all of the doctors from the Office of the Chief Medical Officer at First Nations Health Authority are doing these interviews and answering these questions, and we're open to answering more. We do want to encourage as many people to be vaccinated as possible. And I can tell you from my own experience that I was so relieved to finally be fully vaccinated, because for me, I have family that lives in Ontario that I haven't seen, including a 3-year-old grandson. I am a bit of a travel bug. And so I'm looking forward to more adventures and being able to travel. I don't know if people know about this. I know I've been on CFNR a bunch of times, but I'm a scuba diver. So I really want to get back in the water and explore the beautiful underwater world again. And so I am super happy. I'm super excited to be fully vaccinated. And I hope people who also have been fully vaccinated are feeling that relief and that joy at getting together again.